and certainly until last year, loads of basically low-quality studies that, in aggregate, I think probably convinced me that masks did do something. But in terms of what, how much, there's this vast space where people have argued they're everything from a panacea to sort of useless or even negative face nappies.
The great mask debate of 2020 and 2021 is still there in 2022. Why is it? Because it became, as you say in your very good piece, that it became a culture war thing. It became sort of based on your politics, whether you'd be more likely to wear a mask or not. How do we not know for certain in 2 sentences, this is what it does, this is what it doesn't do, this is what we know?
Yeah, I mean, this was sort of my point, and I'm well aware I'm now dipping into immensely controversial waters, although that's almost sort of the point of what I wrote. It became this facial shibboleth of politics, and just step back and think how utterly ludicrous it is that a medical intervention is somehow now a political signifier. And I think part of the reason is partly the fault of science, partly the fault of the public, in that we don't trial things properly that aren't drugs. It's very rare to do so, and this means that we don't get the real gold standard evidence. You think at the start of the pandemic, we were using all manner of drugs, and then some guys in Oxford said, no, look, we're going to do this thing, which was, when it was first done 50, 60 years ago, utterly revolutionary and considered semi-immoral, which is we're going to try it out. Some people will not receive the intervention, some will. And because of that, we know which drugs work. Now, there's loads and loads of studies on masks. And there's loads of, and certainly until last year, loads of basically low-quality studies that, in aggregate, I think probably convinced me that masks did do something. But in terms of what, how much, there's this vast space where people have argued they're everything from a panacea to sort of useless or even negative face nappies. And the reason I wrote this piece is because actually there has been one in a global pandemic, one really decent study. It was a trial in Bangladesh where villages were randomized, which is so important, into having either masks promoted or not promoted. And in the ones where masks were promoted, it rose from 13% compliance to 42% compliance, and COVID dropped 12%. It's pretty clear that at a population level, it made a difference. But, and this is the thing that is so annoying, they did it in surgical masks. Now, by this stage in the pandemic, certainly by then in the pandemic, loads of us were wearing cloth masks, ones that you wash at home.
That's what I wore, yeah.
Yeah, they also trialled cloth masks. They couldn't find a signal. Probably they had an effect, but it was far lower. So this was absolutely crucial information, which if you've been looking at things in an evidence-based fashion, you just said, you know what, let's change our mask guidance. Instead of having it just a face covering, let's have it a specific face covering. Maybe let's even go for the better fitted ones that only cost £1 or so, the N95s or whatever. But by then, because it was so much more, you wear the face covering, you show you're a member of the tribe rather than what works. It got ignored, and so we are where we are, and I think it's sad because it should just be a matter of evidence.
And the other point there, I think, Tom, is that people were criminalised, weren't they, for not wearing masks, and therefore, based on very little evidence that you're talking about, the politicians leapt to a very interventionist position, which wasn't like the evidence suggests this is a good thing, maybe you should do it. They did that for a while. It then became an act of law either way. And that's where I think a lot of the aggravation comes from, because it was a law based on very shaky foundations, as you've just said.
Yeah, and the thing is, it was always implausible that they wouldn't have an effect, but yes, we did a lot of things based on shaky foundations, as you have to in the pandemic. But one other thing that I mentioned in the piece is, the other really controversial thing was schools. And now I have COVID fantasies, like obviously I've been covering for 2 years, a bit of a weird thing. One of my COVID fantasies is that at the end of the first wave, obviously you had to close everything all at once. You couldn't do things properly and test them. But at the end, imagine if we'd staggered it. Imagine if randomly half the country, you had the schools opening just a week later. At the end of the wave, transmission low, but enough that you could maybe see between the ones that opened a week later and the ones a week earlier, a difference in transmission, which then going into the second wave would have given us hard evidence about how much schools really make a difference. And I think it needs, it's everyone's fault. It's the public's fault. for we don't want to be experimented on. But I would love a change in attitude where we think the real experimentation is using policies without evidence. And in politics, in schooling, in everything, it would be lovely to try all things first.
That's not a bad idea at all, Tom. I think lots of people will be nodding their head in agreement. But we have an autumn coming, and you can imagine, Luke, that the mask wearing is going to happen again. That's Tom Whipple, by the way, our great science guru. He really was a pillar we leant upon during the whole of the pandemic.